I'm Jessica. I am with Pickering Public Library, and I'm joined with Lindsay tonight from Pickering Animal Services to listen and learn from Dr. Mimi Ehrlich from Ajax Animal Hospital, discuss pets and COVID. And if you would like, you can take it away, Mimi.
Oh, thanks so much, Jessica. Thank you so much, Lindsay. Good evening, animal lovers and pet parents of Durham region. I'm Dr. Mimi Ehrlich. I've been invited to speak with you about pets and COVID-19 as part of Responsible Pet Ownership Month in Durham region. So to tell you a little bit about me, I've worked as a companion animal veterinarian at the Ajax Animal Hospital for 28 years, focusing on small and smaller animal care. So when we talk about small animals, people think dogs and cats. We also do a large practice in rabbits, rats, hamsters, gerbils, and pigs, guinea pigs, not pigs. I share my life with my wonderful husband, Frank, and these are my three adorable fur babies. Here you can see Courage, Faith, and Josephine, and they're following their stay-at-home order very carefully. When I'm not practicing medicine, here's all the things that I am no longer allowed to do during the pandemic. Of course, what I'm focusing on now fully is being a frontline essential health caregiver to our patients during this unprecedented time and supporting those who love them. I would like to dedicate this talk to a very special lady, Susie DeLuca, who so wonderfully celebrated the human-animal bond and enriched all who knew her, who passed suddenly from this pandemic of COVID-19. What I'm going to discuss in this talk include COVID-19 and the public health issue, socialization of puppies, preventing separation anxiety, and setting up for a successful veterinary visit. And then at the end, we'll have time on the chat. I think Jessica will be spearheading any questions and answers that you may come across. So what's happening? Why are all the humans wearing muzzles? So I'm not an expert in public health at all, but I know many people who are. So I'm quoting Dr. Maureen Anderson. She's the lead veterinarian for animal health and welfare in Ontario. And they have been looking at animals with COVID to see what happens with animals who get it. And I think there's not a huge amount of information. They're not really able to very safely study pets when people have COVID because they can't go into the house. But as of March 2021, the US had studied 52 cats and 41 dogs with confirmed cases in families that had COVID. And the patients had just very mild clinical signs. And they were the same signs that people had with a cough and a sneeze, maybe a runny nose, some lethargy, but none of them had serious illness. And on Ontario, we had one dog and cat studied as well. And they were all exposed to family members with COVID-19. So the take-home message is, if your pet has COVID-19, they got it from you. We're pretty much not finding that you're getting it from your pets. There are a lot of species we have to worry about. Some are highly susceptible to the disease. That includes cats, including big cats. I think you guys may have heard about the tigers who had COVID. We see that in ferrets, hamsters, primates, rabbits. Minks are a really big issue because of the industry there. Dogs are considered to be moderately susceptible. So the information is still evolving all the time, but there are some main key messages that we want to know. One is that there is no evidence that animals play a significant role in transmission to people, but more investigation is needed on this topic. Two, the risk of transmission from pets to people is generally low. Three, there's some risk of transmission from people to pets. Infection is generally non-symptomatic or causes mild symptoms. And basic precautions for preventing spread apply to people and to pets. What that means is if you're in quarantine, your pets are too. It's actually very important. And be very mindful when you're handling other people's dogs, especially when you're going for a walk. The same way you wouldn't go up to another person and handle them. Just be mindful. I know dogs are adorable, but be mindful to keep a little bit of social distance from that as well. I've included at the bottom of this page a 2-page summary from public health on what to do if you're exposed to COVID with your pets, or if your pets have been exposed to COVID-19, and that's a very good resource for you. Dr. Maureen summarizes with be well, stay safe, wash your hands, and don't eat poop, which is always great advice. Another resource I really want you guys to know about is Dr. Scott Weiss. He's an internal medicine specialist and a microbiologist at the University of Guelph. And he has the most amazing information on worms and germsblog.com. I've highlighted it on the page for you. And that's just a great resource on any infectious disease or pet care that you want to know, whether you're worried about ticks, which are coming up right now, whether you're worried about, should I be feeding raw food? Is that safe for me to do? What's the most current information on COVID-19 and my pets? You know, even the May article was about, should I eat my dog's heartworm medication to prevent COVID-19? And the answer, spoiler alert, is no, don't do that. But apparently that's one of the drugs that they are testing. And please don't do that, because it is a ridiculous thing to do. But he has a really good article on that. And so anytime you want to find out a little bit more about what's happening with infectious disease and have a really reliable resource, his information is really accessible, easily read, easily shared. And he's been an international resource for us. I feel he's been giving us guidelines on how to practice during this COVID pandemic in general, and been doing that internationally. He's actually come down a couple of times and tested some of the pets of my patients who have been positive to help increase our understanding. So if you get one thing from this talk, and hopefully you'll get many, wormsandgermsblog.com would be a great thing to do. Okay, bring on the puppies, because everybody loves puppies. And these are some of the kids that I get to spend my day with. And I think that's awesome. What we need to know is maximum socialization in puppies occurs in the first 16 weeks of life. You know, really, when you think about a dog, by the time they're 6 months old, they're technically almost about to get pregnant. So most of their learning has to happen really quickly. And if something great happens then, they'll remember it. And if something bad happens then, they'll remember that too. Think about a child who touches a hot stove. You might not have to do it a lot of times before you know that that's really not a great thing to do. So we really want to make sure they're not exposed to negative stimuli during that time. And so when we're not in a pandemic, I really recommend people take their dogs everywhere they can, just avoiding throngs. We don't want a lot of people swarming a puppy. But my advice up until now has been to take them to parks and to kindergarten, puppy kindergarten, of course, not kid kindergarten, and to meet men and women and children and someone with a hat and someone with a beard. I think I've just described Santa, and always have a positive experience. And we're really not able to do that in the same way, but it doesn't mean that we can't do it. And so we're finding that so many people are adopting puppies and dogs in unprecedented amounts because they are home and they have time and they want to share their home and they want companionship. But they're really finding it difficult to socialize. And we don't want to see the result of that for the next whole life of your pup. So the general information, which is always good, is socialize your pup to anything you want them used to as an adult. So we want to kind of handle their toes and maybe give them a snack while we do that. And then they're not scared to have their nails trimmed. We want to touch their ears in case they ever get an infection. We might want to touch their teeth as long as they're not in their nipping phase. Comb their hair, get them used to those things. So if they are a breed, especially who has to go to grooming, they've been exposed to that. And that's pretty standard. And you guys can still do that during a pandemic. It's all the different people, places that are a bit difficult. So one of the pictures I have, I think with my niece and her dog flying, what they've done is they've gone to an outside area just to get used to outside. There's no one else around, but puppies can look and watch. And even if you go to a park and you don't want to be in the middle of things because you want a social distance, your dog can still learn a lot by sitting and watching, by being in the car and maybe having a positive experience in the car. By maybe bringing in different surfaces in your house and just, maybe bring in carpet and something slippery so that your dog's walked on different things. Maybe even introduced a couple of different people if you are able to do that safely outside as the lockdowns are limited. And the reason I have a picture of some strange ladies on the bottom is we've been asking our clients to play dress up day. And so if you want to have some fun and you're home anyhow, wear different clothes, wear different hats, speak in a different voice, wear different perfume, maybe even play a YouTube channel that has different animal sounds or people talking on it, just so that your dog's been exposed to that. And of course, in this early time, your dog will also be going to the vet, and we're working really hard to make sure that their experience with us is as fun as possible. We want all the dogs to be happy and excited to come to see us at the clinic. So they give you a lot of treats while you're training. Play as dumb for as long as you can is absolutely true. Lots of treats. Be mindful of the other issue we've been having in the pandemic. We call it the poundemic. We want to give your dog tiny little treats so we can do lots of them, not have them have a weight issue as they get older. Okay, did we forget cats? We did not forget cats. This cartoon just says it better than I ever could. Dogs during quarantine are just so happy there's someone home to play with them, keep them company, keep them active. Cats really, why haven't you left yet, is kind of true. We've actually had a couple of cats who need to go on anti-anxiety medication because their family's home all the time, and they're just used to a little quiet and privacy. So cats will be cats, and no one will ever understand them. We just live to serve them. But I'm not going to be focusing very much on separation anxiety or socialization for cats because cat socialization has not really changed, and separation anxiety in cats is not a major problem that we're dealing with at this point. Okay. So when we're talking about separation anxiety, and I'm sorry, I have pictures of very sad looking dogs right now. And I don't like to see that, but we are seeing more of that. And separation anxiety occurs when pets experience distress when they're separated from their humans. And so the way I like to think about this is if we had a child, and full disclosure, I don't, but if I had a child and I decided to homeschool them, and I decided we would do kinder swim and kinder gym and kinder karate and play dates, and I was with them all the time till they were about 9 years old. And then I said, oh my God, I'm leaving. I have to go out. I hope you're okay. And I ran out the door crying. That child would probably be psychotic at that point because we haven't taught them how to have their own hobbies. We haven't taught them how to be independent. We haven't taught them how not to rely on us. And so up until now, what we used to have is when people would be on a maternity leave or a teacher on a summer vacation, that's when we would talk about separation anxiety. You're going to be home for 4 months and then you're going to leave. And suddenly the whole world has done that. And we've gotten these puppies and we've been home with them all the time. And when that parent left, if they left for 4 to 6 hours and they came home and said, oh, thank God, I'm home. Now we can have fun again. We would be reinforcing that anxiety onto that child. But at least children know about time and dogs do not. So if you go away for 4 hours and that dog panics, and then you come home and they think, oh, it took 4 hours of panic to make you come home. Maybe if I panic more, they'll come back sooner. And maybe coincidentally you did. You've now anchored that being frightened and being anxious is actually what makes you come back home. So maybe if I do it more, that'll make you come back home sooner. So we might see barking, we might see whining, we might see scratching at the door, pacing. The little fellow on the top of the screen has had a little accident on the carpet. And the one in the bottom has trashed the place. And we tend to see that. And what makes it more difficult for the animals in separation anxiety is dogs really do not do well with conflict behavior at all. And so your dog is worried and sad and he doesn't understand what's happening and he really wants to come home, or she. And they become so anxious and so upset, they damage something, like my little culprits on the screen here. And when you come home, understandably, you see your house is completely destroyed and you're angry or you're upset or you get angry at your dog. But then what we've done is we've set up what's called conflict behavior. And that means your pet really wants you to come home, but he or she knows as soon as you come home, they're in trouble. So they really don't want you to come home. And they don't know how to deal with that dichotomy. It's just terribly, terribly stressful for them. So what do? They bark, they whine, they scratch, and now you've really anchored that behavior. So that sort of in a nutshell is what all of separation anxiety is. So what can we do to resolve that, prevent that? Resolving is a different story, and we'll talk about that in a minute. But how to prevent it is really important. So if we went back to that analogy of the parent who's leaving their child for the first time, if you left and you said, okay, I'm going now, here's pizza, here's Nintendo, here's, I don't know, movie, some candy, but when I come home, we're doing homework. That child doesn't mind so much that you've gone. That's okay. We've got all this good stuff going on. And then when you come back, it's like, now we're going to sit down and do homework. It's like, well, it was kind of more fun when they weren't here. So that's what we recommend doing, is to give your dog a hobby that is not you. And you do that first when you're there first, so that they learn it is a fun hobby. A dog's fun hobby may be a special toy. Let's be honest, most dogs love food. We get something like a Kong or something hollow. You can put a little bit of cheese whiz or peanut butter or cream cheese. I use canned food. I put a couple tablespoons of canned food in and I stick it in the freezer. And once it's frozen, it takes your dog 2 hours to get through that. And so what you do is you give it 5 minutes before you leave, You let your dog be very happy and enjoyable, and then you quietly leave the house. You don't do a big hello or goodbye, because that's saying now it's time for you to be upset, or, oh, I'm back. Now we're allowed to have fun. And so you just quietly step out. And I would suggest the first time do it, just do it for 5 minutes, quietly go out, come back, no big deal, nothing happened. They're learning to be by themselves. Because what we're seeing now is dogs are coming in, because the pandemic's been going on long enough, that they are coming in for their spay or neuter surgery, and they've just never been without their human ever. And it's really stressful for them. So setting them up to be successful is fantastic. And if you give them the hobby and the quiet goodbye and quiet hello, and then you might leave longer. You might even mix up your cues. You might walk out the front door and then quietly just walk back in the back door. So no big deal, nothing happened. And if you're worried that your pet might be anxious when you're away, set up your phone to video it. Not for 3-4 hours, but if you go for 5 minutes and you want to see what your dog is doing, that's a great way to find out what's going on. The most important thing in separation anxiety is to never, never punish. The opposite of reward is, this would Jessica would remember, this is the interactive moment. It's just not a reward, okay? It's never punishment. If you do punishment, you are now anchoring that fearful behavior, and then you're going to have a much bigger problem, okay? Now, one thing people say a lot is, oh, my dog knows they did something bad. They look guilty. And the truth of the matter is, they do know they are in trouble, but learning doesn't happen from that. And it's a really important differentiation. So if, for example, your dog comes home, he's pooped to the carpet, he's looking guilty, he may learn you're coming home and he's going to be punished, but that does not teach him, therefore, I should not poop on the carpet. I like to think of that like, let's say you're walking down the street one day and the sun is out, you're in a good mood and you're singing a little song, and someone comes along and slaps you in the head. Now you may go, oh my God, that person is crazy. Or you may say, well, maybe singing is pretty bad. Or you may say, do they think I'm somebody else? You're never going to go, oh my God, I forgot to flush the toilet yesterday. Like you're just not going to think about it. But when you see that person again, you will show that hesitancy, that worry, but it's still not going to make you think about flushing the toilet. So really important. Never punish. Yes, they will look guilty. They will not have enhanced learning. We really don't want your dog to look at you coming home like in the olden days when it's like, go bring your father the belt, or wait till mom comes home and you're in trouble. We don't want that concept for them at all. Okay. Some resources for you. So Fearfree Happy Homes, that's another big bullet point I'd like you guys to keep track of. That's a website that's really, really fantastic. It's really family friendly. It's a series of 5 to 7 minute vignettes, cartoons, little videos. It has a lot of information on socialization, on preventing nipping, preventing jumping up, socializing to nail trims. That's, I think, something that we're really going to need to do when groomers aren't always available, preventing separation anxiety as well. And a lot of it is very child friendly, because certainly you want your children who aren't too young to be involved in helping train and socialize your puppy. If you have a concern that your pup may be developing separation anxiety, or you truly have a dog who has the medical psychological disease of separation anxiety, book an appointment to speak with your vet. And my recommendation is not do, hi, I'm here for my annual and we have a lump and there's an ear infection and I need my blood test and there's a wart on my dog's butt. And by the way, he's destroyed the house at the same time, because this is a really big information. It might take a good hour to discuss it appropriately. So feel free to call your vet and say, you know, I have this concern. Do you do behavior work? If they do, that's great. If not, there are specialists available and there are also trainers available for you. We have nutritional supplements for mild cases that are just food supplements that are calming and relaxing. And that could be anything from valerian root, which is a natural calming aid, milk casein, which is what's in a glass of warm milk or mother's milk. That's why babies fall asleep after nursing. Tryptophan, that's the active ingredient in turkey. That's why people generally don't make it through the whole football game. So we have all of those natural herbal things just to make sure your pet isn't too anxious without actually giving medication. But in a case where a patient truly has separation anxiety, and I think that's beyond the scope of this talk today, anti-anxiety medication is definitely something to think about, because if your pet has a true anxiety, learning cannot happen in a time of fear. And I think that's just important. We're all learning that as we're navigating these difficult times together. Okay, setting up for a successful veterinary visit, or Dr. Mimi's top 10 list, what not to do at your veterinary visit. Number one, do not come into the clinic. In case you didn't notice, we have a big stop sign on the door. Most clinics do. And when we book an appointment, the receptionist will remind you that we are doing curbside care only and that you can't come in. That being said, every single appointment, people are like, are you sure I can't come in? Because I'd really like to come in. And my pet does better with me. So we are actually required to follow guidelines through health and safety. And people are not allowed to be in a waiting room. And if you did come in the clinic, you would not be allowed to hold your pet because of social distance requirements between ourselves and our staff. And the amount of people who work in our clinic, we are just be over the amount of people allowed. So we are not allowed to have you come into the clinic. We're doing curbside care. Otherwise, we cannot care for your pet safely. I know that this is difficult for you. We also wish that you could be in there with your babies. But we have become quite expert at doing curbside care and looking after our pets in a very meaningful way. Don't be anxious, or at least try not to be. So we are working tremendously hard to make sure that your beloved pet are happy and safe in our care. Our array of treats include liver snacks, canned food, we have squeezed cheese, probably not a healthy option, but delicious. We have toys, we have cuddles, we have laser pointers for the cats, feather toys. We have little hidey boxes so your pet can feel comforted. We use pheromone sprays. Those are natural hormones. The cat one is the one that when your cat rubs their head against you, they're marking you as theirs. That's called Fellaway. And the dog one is called Adaptil. And that's what a mommy dog makes from her breast tissue when she gives birth. And it tells the babies, I'm your mom, you're my baby, we love each other. I spray that on me every day. Every single pet comes in with a blanket sprayed with it. And when dogs are in our run area, we have that going on as well. We also have music called Through a Dog's Ear that has been studied, monitoring dogs' brain waves to be calming and relaxing music for dogs. And we try and play that as well. What you need to recall is if you are anxious, your pet will be too. And if you have questions about it, make sure you talk to us about it. So this little lady here on the left side of the screen, she actually woke up from surgery about an hour ago, and you can see it's not an elegant pose, but she's completely comfortable, relaxed. She's on blankets, and she just wants to have a belly rub. And that's what we do with what we call fear-free care. And on my right is an array of what we use in almost every appointment. There's some ice cream there. There's some canned food. The mellow cookies in front are the ones with the nutritional calming supplements. Benny Bullies are dried liver. And you can see an array of toys that you can stuff to use at home as well for separation anxiety. There's a laser pointer, there's a cat mouse, and a feather toy. So all of those are available to keep your pets entertained and safe. And if your pet has a food allergy, bring some of your dog's favorite food. Bring a snack along. Like, we want to be able to sit on the floor and feed them. We don't overfeed them. We take each treat and break it into 10, and then we give them all 10. But we want them to feel comfortable and relaxed. I pretty much spend most of my day nowadays sitting on the floor with puppies and dogs. They just prefer when you're not there to be on the floor. And so we work hard about that. What I would ask you to be sure to address is if you're concerned your pet is too anxious to come into the clinic, we do have options for you. Number one, our governing body has now allowed telemedicine appointments to maintain a professional veterinary client-patient relationship. That means if you feel your pet is too frightened to come in the clinic, you book a time and we do a telephone consultation, probably similar to what you've needed to do with your own doctors at this point. And we can then be your veterinarian without your dog having to come in. And it does require a little time. We can book about half an hour to 45 minutes, but it can go over any concerns and health issues that you have, and we're able to provide care without your pet needing to come in. The other thing is if you're worried your pet is anxious in the clinic without you, we have an array of sedative or tranquilizer tablets that we can give you. We have call in advance and we do what's called a fear-free consultation, and we can decide what medication you might want to give your pet beforehand. And if your pet's truly anxious in clinic, we'll stop the appointment and say, let's rebook it. Let's either give a sedative, let's give a tranquilizer. Let's find a different way to make this work to keep your pet safe. At our clinic, Ajax Animal Hospital, we work hard to personify fear-free veterinary care. And we want that to apply to you as well. We would like you to be fear-free as much as possible. Number 3, don't forget your cell phone and make sure it's fully charged and not call block. So because we're doing curbside medicine at our clinic, first we phone you, we go over history, we go over background, we go over any concerns that you have, and then we come and get your pet. And don't forget, you're the one who's speaking for them. And then once we finish the exam, we call you back and we go over what our findings are. We make a plan. So you're very much a part of the appointment, even though you're not coming in. But very often people either didn't bring their cell phone, it died halfway through, the car answered the phone and they were outside with the dog. And as we get more and more calls for duct cleaning and such, a lot of phones are on a no call block or on call block. And so we can't get through, and then it just delays the time that we should be spending communicating really well for your pet. Number 4 is don't make other plans. With curbside care, appointments take quite a bit longer than usual because we first have to talk with you, then we see your pet, then we need to talk with you again. And in these very challenging times, we're also sometimes behind because we're not able to see as many patients as we want to see between the protocols of cleaning and social distancing. So set enough time for us to take care of your baby. We'll sometimes come out with your dog after the appointment. The car is gone. Oh, sorry, we went to get a Starbucks. Or we just make sure you're there so that we can get your pet to you as safely as we can. Okay, number 5, don't forget your mask and your social distancing. And I know we've been in this situation for 15 months now, but when your pet is sick or your pet needs care, you're just thinking about your pet, and that's what you're supposed to do. But we still do need to keep ourselves safe. And so I can't tell you how many times someone comes in and they're terribly worried and they're holding their cat clutched in their arms and they don't have a mask, and we just can't put our staff at risk like that. So what we ask you to do, if it's a cat or a hamster, a mouse, a guinea pig, a gerbil, rabbit, have them in a safe carrier. We then have you put the carrier outside and step about 6 feet away, and then we're able to safely bring them in. If it's a dog, what we work hard to do is we bring our own leashes and we try and change leashes if your dog will tolerate that. And also, please remember, if it's a dog, we really, really don't want to do a tug of war, pull your dog into the clinic. So we have a lot of tricks and tips we can do, but make sure you're not trying to drag your dog towards the clinic. That's very frightening for them. If you were in the park and someone came and grabbed you and dragged you into the bushes, even if it was just to say, ma'am or sir, you dropped your wallet, you still have that fear. It doesn't go away just because you're in a safe environment. You still had all that adrenaline. So we have all kinds of ways to happily and safely get your dog into the clinic. And just make sure we do it in a social distant way. Number 6 is don't handle other patients. It can be irresistible. There's a new puppy out there, or someone has a border collie and you do too. I find there's a bond that forms between people who love animals. And I think that's a beautiful thing. But we're having a lot of people spending a lot of time in the parking lot with not a lot to do. And it can be almost irresistible to go handle other pets. Just remember that pet might be fearful, that pet might be sick. And as we discussed in the public health component, social distancing does include your fur babies at the same time, because we know they're asymptomatic carriers for people. We don't want you handling pets and putting yourself or your family at risk. Don't come into the clinic if you're unwell or exhibiting signs of COVID-19. I feel we've seen that on every single place we've been for the last 15 months, and I think enough said. Don't be unprepared for the weather. And that's important because, if you are waiting 15 or 20 minutes and it's hot out, make sure your car air conditioner is running, or that you brought water for your dog, or that you maybe drive around to find a shady spot in the parking lot. I know that sometimes can be hard to do. And if it's particularly cold out, make sure that if you have to wait, especially we have a percentage of clients who come from Uber, make sure you're really prepared for the weather. We want you as safe as possible. Don't block high traffic areas, the doorway or pickup locations. We are doing social medicine. There are 7 doctors at our clinic and 7 technicians. That's a lot of people coming in and out. And we also have a transfer bin that a lot of people are going in for. It's the time of year for tick medication. It's the time of year for heartworm medication. People need to pick up their prescription pet foods. There's a lot of people back and forth. So just make sure that you leave that 6-foot area and you're wearing your mask around there. And the number 10 most important don't forget that we love them too. And that was a great day at the Ajax Animal Hospital. Not every day is like that, but that's what we want you to feel like when you bring your pets to the clinic. Happy, warm, and fuzzy, and everyone sharing a lovely experience. So I'm going to pass this to Jessica in a couple minutes for questions and answers. But first, I just wanted to say thank you for bringing up this very important topic and getting the word out on how to maintain your safety, your pet safety, and our safety during a pandemic. I wanted to really appreciate that the Pickering has responsible ownership and stewardship month, which is a great thing. And I wanted to shout out to my lovely sister-in-law, Rochelle, who has helped me do any audio visual part. So you're not just staring at a blank screen. Thank you and stay safe. And I am going to pass you to Jessica in case anyone has any questions.
I kept my microphone muted. Sorry. That was amazing. Thank you so
I've never
much.
heard you be so quiet, Jessica.
I know, right? So we do have a couple of questions in chat, and if anyone wants to write any questions in the chat, we can definitely look at those. So this question came up during the discussion about herbal supplements. So where should we get herbal supplements? Are they something we can get from the vet, or do we purchase it on our own?
So most of those are possible. By definition, those are non-prescription supplements. And so you can buy them from the pet store. You can buy them from Amazon. There's also a lot of talk. A lot of people want to know about CBD, which is an anti-anxiety, and it is a legal product. It's a little difficult in the veterinary field because although it's a legal product, veterinarians are not allowed to prescribe it. So if you have questions, your veterinarian may talk to you about it, but they cannot actually prescribe or provide that product for you. And I think a lot of the vet clinics carry a lot of those products as well. So it really depends. There's certain ones that are truly veterinary only. I know Purina has PVD Calming Care. And what that is a probiotic that I'm going to sound like a commercial, but I have no link to the company. It's a probiotic that instead of being for digestion, it's for the brain-gut axis, which maybe a lot of people have heard about because of depression and anxiety. They talk about the brain-gut axis. And so bacteria that are formed in your bowel that can help calm your brain. And that's a little supplement powder. That one is only through your veterinarian, and it's just a powder you put on food. The nutritional supplements do take up to a month to see full effect. But I think you could pretty much buy them anywhere. Your vet may advise you more about which ones might be more appropriate for you. We also actually have a food out called Calm, and that's Royal Canin, again, not meaning to be a shout out, but that's a food that your dog or cat can have that has the tryptophan, it has these milk casein in it, but it's only effective in animals under 10 kilos, or else you'd have to eat too much of it to get the benefit. So there's a body mass surface ratio that impacts that, but you can get that at your vet. And don't forget the cats. There is TV's Multi-Care Stress that has those same components in it for cats, and the Calm diet is also out there for cats.
Awesome, thank you. And then there was another question about going to the vet during COVID and bringing service animals into for veterinary care. So how would that work with the individual who has the service animal, I think is what the question's asking.
So that's actually a fantastic question. And I do work with some service animals, but I have not had that come as an issue for me. So I guess I can only tell you about my experience. When I have a working service animal with me, the dog work, because I only work with dogs or service animals at this point, is to keep the clients safe or controlled in their environment. So because the clients aren't coming into the clinic, that's not an issue. The guide dogs I work with, when they come into the clinic, I differentiate. They are not there as service dogs. They are there as patients who need care. So their whole lives, I've worked for them. They're comfortable with me. I've always taken them to the treatment room, to the exam rooms, had them meet all of the staff exactly for that reason, because it's very stressful for a service dog to be separated from their charge, I think I can say. So what we have done in this situation is the dogs that I work with, their service, are totally happy coming in and having cookies. They're just not working when they're in the clinic. If they were actually working, it would be to help the owner, and we would probably find a way to do that in an outside environment. But of course, if that was an issue, call your clinic first, make sure you're clear what you have to deal with and how we can do it safely. Some of my service dogs are for hearing assist. So we have had the Hearing Aid Society give us clear masks, because it's very difficult to communicate with someone who doesn't hear, whose dog is necessary for their communication, and they can't see your lips. So we have a series of clear masks that we're able to use for that situation. So as long as we're prepared, best we can be.
Perfect.
I don't know if I fully answered that. I think it's such an individual basis, and clinics who work with guide dogs usually have a lot of experience and a tremendous amount of respect for those dogs who impact lives so meaningfully.
I think that answered the question. So again, if you're bringing your animal to your vet and you do have any questions, best practice would be to call ahead and just ask those questions, get them clarified before you're in the parking lot.
Sure.
Awesome. Do you know if many clinics in Durham are using the telehealth option? Is that something that's available to all clinics that has been just put forth?
Well, it's a great question. So I know our clinic is using that. I know our governing body has authorized that for us. As a matter of fact, they're in the middle of discussion with veterinarians now to see if we should make that permanent. So I know that we are allowed to do that. That doesn't mean that all the clinics are choosing to do that. I think that's on an individual basis. I don't want to sound like a broken record. Check with your clinic. We have definitely been doing it. I think as long as we know this is what we book it as an appointment, and that when we call you, you're at the time. And we actually do a very thorough job. And to be honest, in some cases, I found without the distraction of the car and the parking lot, and we're just sitting and having a good conversation for 45 minutes about all the things you want to know about your pet. And between sending a video of their behavior or sending a picture of to quote someone, wart on their butt, or anything else, we're actually able to do quite a reasonable job at that. And sometimes better because we don't have to have distractions in the appointment.
Awesome.
Yeah.
Another question is, what can we do to help alleviate the anxiety that their dog faces in car rides? So they have difficult times getting their dog into a car, but once he's in the car, he tends to be okay. And before you answer, I'm just going to preface this as you cannot give out veterinary advice right now that I don't have any expectations that you're going to be able to diagnose a dog that you have not seen through a Zoom call comment. So I know you won't be able to give a full answer.
I won't give a full answer, but I can give a little bit of information that might be helpful. And on top of that, I'm really not a political creature, to be honest. I just want to help animals, and that's kind of what I do. So number one is if your pet is nervous for getting in the car, really differentiate if it's fear of car or nausea, because a lot of dogs actually get car sick. And they've shown that if you link a behavior with nausea, you will always dislike it. Like if you've eaten a bad clam, you will never want a clam again. Or they've actually tried to do certain behavior aversion by linking it to nausea. So if your dog's nauseous in the car, it's possible that they're just fearful of that. And there are some very good medications that you can speak to your veterinarian about that. There are some spectacular medicines for that. If your dog is nervous about the car, and this is not medical advice, but general behavior advice, the term we use is systematic desensitization. That means gradually getting your dog used to what they're afraid of. So you might, just walk around the car, maybe every day for a week, and maybe feed treats the whole time you walk around the car, and the car is not running, and you are not trying to be sneaky, and you're not trying to be too fast. And then you might do that for a few days just with the car door open, and you're not trying to get the dog in the car. You're just trying to walk the dog around with the door open. And then maybe you're sitting in the car and the dog isn't. And maybe you're having some treats when you're doing that. And to just gradually get them used to what they need to get used to. There probably is a really good component on Fearfree Happy Homes, that website, about systematic desensitization. It probably won't be specific to the car, it'll be to anything, but certainly you can do that. But and then if it's a true fear, you need to get over that, because you might need to take your dog to the park or to the vet or anywhere else. So I would put that time into that systematic desensitization and just make sure that you don't suddenly do what's called flooding in the middle of that. That means if you spent 4 weeks getting to the point that they can sit in the car comfortably, it's running, and you're not going anywhere, and then you take them on a 3-hour road trip, you're going to undo some of the work. If I'm terrified of spiders and I can handle like a little teeny spider across the room, and then you come and put a tarantula on my head, I don't trust you right now. You've broken that trust. So make sure you're doing it at a time that you don't have an anticipated road trip, so that you can really build on what you're doing. You might give some of those nutritional supplements first. You might play that through a dog's ear music at the same time. And some people have had success with what's called a thunder shirt. That's a little coat you can buy that you snug up on your pet. It's meant to be based on Temple Grandin's swaddling, like getting a hug. A lot of people are using weighted blankets for the same situation. I've not had huge success with it. People kind of say, a little bit, but you know what? Sometimes all you need is a little bit. So that's an option you can try as well.
Great. Thank you for that answer. I know we had talked briefly before we started the talk about the importance of tick and heartworm medication, just with it being, I think that was drilled into me when I was a student as well, is just heartworm season, tick season, and kitten season as well. So I think that's really important, ensuring that even though we are in a pandemic, that you are able to book or try to find ways to get your pet spayed or neutered if that is appropriate for them, and talking to your vet about that. And then also heartworm medication and prevention, flea and tick prevention routines. That can all be done through this pandemic too, right, Amy?
It can be, and I couldn't have put it better myself. So yeah, this is May. It's our busy time. We're trying to get dogs in to do their wellness blood work, do their heartworm testing, but tick prevention, I'm just going to clarify that because you bring up a great point. You don't need a blood test to get flea and tick medication. Okay, people are very familiar with getting their heartworm medication, but you do not need a blood test to get your flea and tick medication. And we're seeing a lot of dogs with ticks on them, and we've seen quite a number of dogs positive for Lyme's disease just this past week. So they're out there, and you can get them too, by the way, not just your dog. So if you're out walking where your dog is and your dog's getting ticks, you check yourself as well, please.
Very good point. Very good point. Any other questions before we say goodbye? I think we are good for that then. So I just would like to extend a huge thank you to Dr. Mimi Ehrlich from Ajax Animal Hospital for joining us tonight. It has been amazing to hear you speak about your love of animals and just how happy I think when I used to work there, it was just like puppy appointments were the best. Like having animals in the clinic, they had a blast from start to finish, and it was just the happiest place to be most of the time. So absolutely amazing. Thank you so much for joining us and speaking to your love of animals. Lindsay, did you have anything to add?
I just wanted to thank Mimi as well. Like that was a fantastic talk. I know I learned a lot. I didn't realize that telemedicine was something that is now being in the process of being approved and might actually be implemented at a sort of bigger scale. That I think is fantastic as an alternative option, especially with COVID right now. But everything you talked on, I think totally hit home, at least with me. I'm sure with all these people here, and I definitely appreciate the time that you've taken today to educate us on this really, really important topic. So thank you.
It's been my great pleasure. I really appreciate you giving me this platform. Take care and be well and stay safe. And don't eat poop.